Hey everyone, it is Mark Scholz with Oil Respect. I'm here with Sarah, a registered nurse in the province of Alberta. We're talking about oil and gas and how we use oil and gas today. We have some really big issues that we're talking to Canadians about, so the importance of our energy products. But one of the things that we wanted to talk to Sarah about is how we use oil and gas products in healthcare delivery. And everybody knows that nurses have an incredible job to do as you are in life and death situations, delivering services to folks who are sick and in need. And we wanted to talk to you a little bit about how important oil and gas products are in your field of expertise and the services that you deliver in a hospital. So give us a sense of, what, in your day-to-day duties and tasks as a nurse, why are oil and gas products so critical to what you do?
So every day, nurses and doctors are using products made from the oil and gas industry in their practice to deliver healthcare to Canadians. So from all of our equipment that we use, so that would be catheters, needles, syringes, sterile and non-sterile gloves, bandages, bedpans, everything that is plastic, nurses and doctors use, and that also encompasses medication. So aspirin is made from petrochemicals.
Right.
Antibiotics such as penicillin, which treats many infections such as pneumonia, that is all made from the oil and gas industry. And nurses and doctors are using that every day in their practice.
So it seems pretty critical. So I would imagine that when you were learning and getting trained to be a nurse, that the importance of the oil and gas industry would be a fairly large part of the curriculum that you were engaged with as you were getting trained to be a nurse. Is that the case today?
No, unfortunately, while I was in university, my curriculum was not fair to the oil and gas industry. So nurses in my group of students were taught that the oil and gas industry polluted the environment and therefore affected Canadians' health. So they suggested that it polluted drinking water and caused respiratory illnesses and diseases. So nurses were basically being taught that the oil and gas industry was affecting people's health and that nurses should stand against the industry and should lobby and be activists against the oil and gas industry.
So when it comes to ultimately paying for all these services, paying for the advanced equipment that have petroleum products embedded in them, the oil and gas industry, of course, is one of the large contributor through the tax system to pay for a lot of these services, not only the equipment but also nurses' salaries and doctors' salaries. Maybe comment on a little bit about how important that funding is in order to have a sustainable healthcare system.
Yeah, so with our aging population, there's going to be more need for funding, and every year, particularly here in Alberta, this year we had an increase in our funding for healthcare services. So that covers hiring more nurses and doctors, building new hospitals, clinics, medical centers. There's going to be a new cancer center built here in Calgary. As well, there's going to be more money being spent towards senior home care and building more long-term care facilities. So those are all wonderful things that the oil and gas industry is contributing to our healthcare system.
Let me ask you this. As a nurse, but also an engaged citizen, what do you expect your political leaders to be saying on a domestic stage, but also an international stage, about how we develop our products here in Western Canada? Do you think that they're fairly characterizing the amazing opportunities we have here in Canada?
I think, unfortunately, right now you have different political groups, taking their shots at the industry. And unfortunately, the oil and gas industry is receiving so much incoming from politicians, biased media, and environmental organizations that it's not really getting the footing that it needs to tell Canadians, hey, this is what we're doing, these are our wonderful contributions.
Right.
And I really hope that our politicians would stand up for the industry and then support all the development that needs to happen to move this industry forward, whether that's approving pipeline projects, or getting rid of some of the more regulatory means that they're placing on the industry. And then, telling, the world, being on the world stage, I think that they should celebrate the industry and say, hey, this is what this great industry is doing for Canadians, and,
Right.
It's helping our healthcare industry, and it's providing so many amazing things. So I really wish that would happen in our country.